Abdominal pain in children is common, and there are many causes of abdominal pain that are different based on the age of the child. We can, in general, divide abdominal pain in acute and chronic. Acute means that the onset of the pain is usually within the last 6 months, differently from chronic abdominal pain, when basically the pain has lasted for at least 6 months, and it can usually come in a recurrent way. It is important, especially in children, to understand if the cause of the abdominal pain is a medical problem or is a surgical problem. The most common cause of abdominal pain in children is gastroenteritis, which is an infection that can be viral or bacterial in origin. The most common surgical cause of abdominal pain in children is acute appendicitis. As I mentioned at the beginning, there are many causes of abdominal pain, and some causes are specific to certain ages. For example, infant in the first year of life can have abdominal pain related to a blocked inguinal hernia. Older neonates from 6 months to about 2 years have intussusception as the most common cause of their abdominal pain. Intussusception in this age group is characterized by the fact that the intestine telescope in another piece of intestine, and this is causing a blockage. In older children, usually after the age of 3 years, the most common cause of surgical cause of abdominal pain is acute appendicitis, and this has characteristics that are similar to adult when the child is usually older than 6 or 7 years old. In children, we diagnose abdominal pain based on an accurate history taking, which is basically giving us enough information about the age of the child, about the associated symptoms that are coming with the abdominal pain, and also about the location of the pain in the abdomen. Following history taking, it's very important to perform a very detailed physical examination, and for this reason it's important to be seen by an expert pediatric surgeon who has skills in performing a very accurate physical examination. In most of the cases, we are able to make a diagnosis with just the history taking and physical examination. There are few cases where we need to request some blood test or some radiologic investigations, such as an ultrasound scan of the abdomen or a CT scan or an MRI of the abdomen. The interpretation of these studies will basically help us to define the cause of the pain. Abdominal pain in babies can be very challenging to be recognized, and we often need to use associated symptoms to define the nature of the pain. In particular, if the baby has inconsolable crying or vomiting or diarrhea with blood, or abdominal distension, the fact that the abdomen is bloated, these are specific signs that the baby is suffering or may be suffering of abdominal pain. Appendicitis is the most common cause of surgical abdominal pain in children. In older children, usually after the age of 6 or 7, appendicitis presents similar to the adult acute appendicitis. And in particular, it's very important the onset of the pain in relation to other symptoms. So abdominal pain, usually in the periumbilical area, is often the first symptom of acute appendicitis. To be acute appendicitis, the pain usually migrate usually in 24 to 48 hours to the right side of the abdomen, and in this time frame the child develops other symptoms such as low-grade fever, nausea or vomiting, and sometimes loose stools. In younger children, below the age of 6, the diagnosis of acute appendicitis is more challenging than in older children. And this is caused by the fact that the time from the onset of the symptoms to having a complicated appendicitis, even a peritonitis, can be really short. So if you have a child with abdominal pain that is not moving a lot and is having fever below the age of 6, these are red flags to actually bring the child to see a doctor as soon as possible to make sure that the possible diagnosis of acute appendicitis has been made in a quick and timely fashion.